welcome to the monthly community forum for the Academy for Addiction and Mental Health Nutrition. And today's topic will be the role that proper nutrition plays in mental health and the role that issues in nutrition, issues in digestion and absorption play in relapse and mental health issues.
Right.
So two things are going to happen today. As always, I'm going to do a little bit of teaching and take questions. And then I really want to hear success stories that if any of you have positive stories about how shifting nutrition and healing your gut has positively impacted your mental health and your recovery, now's the time to share these stories to encourage all of us and inform all of us. Very quickly, I want to go around the room and do introductions. I think everybody knows me. I'm the founder and director of the Academy and the primary instructor. And this forum is open both to current students, alumni, and the general public. So from my screen, I'm just going to start from left to right and call names, and we'll go from there. Demetria.
Hi, I'm Demetria. I'm Christina's daughter, and I am also currently finishing up the core training, about to start level 2. I also have a side interest in female hormone health. So I would say that's where most of my practice currently is. But it started from this mental health approach and very quickly sort of became like this bigger thing. But I still have a huge interest in mental health nutrition and what, and amino acids and what we're doing here. And yeah, happy to be here. Nice to meet you all.
And she lives in New York City.
Yes.
All right, Laura Lee.
Good morning. I'm sorry if I'm buzzing. Am I buzzing?
A little bit.
Not on alcohol anymore, right?
So exactly. This time it's just your computer.
So I'm 246 days alcohol free.
Right.
So I am in Oklahoma. I just finished the coursework for level 1, and I'm doing my internship this summer, and I'll be doing the level 2 with Christina in the fall. So I'm excited about that. And I am just really excited about this work. I've been already interacting and working with all kinds of people, like my hairdresser trimmed my bangs yesterday and on Monday and get on amino acids. She's tired of the Ritalin and the uppers and the downers and all the things. So I'm so blessed to be a part of all of this academy. So.
Oh, that's great, Laura.
Yes.
All right. Well, welcome. Tom.
Hi, I'm Tom Rohr, and I'm recently moved from Northern California to Colorado Springs. Most of my career has been in addictions, which is a long time since I'm fairly old. And let's see. So I am 35 years clean, and about 5 years ago produced a book in which has a few pages on nutrition. And my therapist when I was in treatment was Julia Ross, and there's some of you know. And I did 10-1-1 workshop, thought about doing her certification, and then didn't. Let's see, what else? So my focus at this point is obviously addiction recovery, but also performance. And although I'm doing more and more sports performance, I think it's performance in a very much general sense. And I think that's it.
Well, great. Welcome. I'm glad you're joining us. We have several members of our community in Colorado Springs.
Great.
Yeah. So maybe we can find a way to hook you up. Anyway,
Sure.
Welcome.
Thank you.
Colleen. Unmute.
Well, that should help. Sorry about
A
that.
little bit.
Hi, everyone. My name is Colleen Lawton. I live in north of Boston, and I completed Christina's level 1 training last spring. I'm a functional medicine health coach. I work primarily with people who have autoimmune conditions, and quite a few people with Parkinson's and Alzheimer's, and neurodegenerative diseases. And obviously, gut health is very important. And this topic came up with the gut-brain connection and the aspect of amino acid therapy. And I've just been really amazed at the power of amino acids can do. So I'm really looking forward to this discussion this morning.
Wonderful. Welcome. Mark.
Morning, everybody. Yeah, my name's Mark Stiles. I've spent 25 years working in the addiction recovery fields. Ran and was involved in the running of residential treatment centres for about 13 of those years, and then went on to really specialise in working with whole families addiction recoveries. So I guess that's where my kind of niche is. I came to the academy eventually after using 7 weeks to sobriety. So Joe Matthews Larson's book with numerous families, and thought I better get some certification in doing all this stuff. So hence I came to the academy, and then. So I'm just finishing off level 2 at the moment, and working alongside Christina doing some exciting work in terms of collaborations, kind of between each other of us in the academy and externally as well. So yeah. And I'm in the UK, by the way. I'm not quite all alone. There's three academy members in the UK now, but I'm working on changing that. So here we come.
And some of you have already experienced Mark's brilliant help in supporting the building of your businesses and collaborating with each other. And so that's something that the Academy is beginning to offer, because we brought Mark on board, is real support in practice development. And we're now offering a free monthly practice development class, individual coaching, and we will be offering some courses. There we go. I can talk. All right, glad to have you with us, Mark. Jeff.
So I'm Jeff Jones. I am east of Boulder, Colorado in Lafayette. I'm a therapist, addiction counselor, interventionist, family coach, that kind of thing. So to follow up on what Christina was saying about Mark, I can, definitely contend with his support. It has been incredibly helpful for me. So within the last month or something, I did a webinar on Joan Matthew Larson's alcohol biotype and detox and maintenance protocol. And Mark was incredibly helpful with that and helped me to set up like an 8-week program for that, which I'm really excited about. And in that process, I've already used that, the survey part of that with families to help them shift how they see the problem of alcoholism with their loved one, kind of shifting from, they're arrogant, they're lying, it's a behavioral thing, and to it's a biological thing. so that's been really powerful. I am so appreciative of everything I've learned with the Academy. One of my most recent wins is with a client I was consulting with Christina about just a couple days ago, probably. The client without the gallbladder and 26 years of Lyme's and all that. And she initially, I initially started working with her to help her sleep better. I made some suggestions. She's sleeping better, which she hasn't in like 28 years. So that caught her attention. And then the suggestions, the next level of suggestions. And Christina, I really appreciate this slow, gradual, methodical little thing, because that really works for her.
Mhm.
So she's so much more open to that. So yeah, there's a lot that I'm learning, and it's not. I mean, of course, there's so much I'm learning about the body and the biochemical restoration, but it's like the other thing that I'm learning is about belief systems and people being open to the biochemical change process, or what's in the way for them specifically of being open. So I'm glad I'm here. Thanks for having this.
You're welcome. So glad you're with us, Jeff. And Jeff didn't mention it, but the next step that we are going to be taking with this client who has no gallbladder is supporting fat digestion. And so that fits totally into today's topic. And so we might actually talk about your client just a little bit today as an illustration. Emily.
Hey guys, I'm Emily. Let's see, I used to live in Denver, but this last weekend I moved to Vail Valley. So I live up in the mountains now. It's absolutely beautiful up here. And so my passion, my business that I have right now, I'm obviously had to move it up to the mountains. But I am a certified yoga practitioner. So I've taken my yoga to incorporate treatment for people with addiction disorders or trauma, PTSD, really anything in life, really. So I use the avenues of yoga therapy, amino acid therapy, nutrition, and just personal, coaching. I have a master's degree in psychology, and according to Christina, I can call myself a therapist in Colorado. So I guess I'm a therapist, registered psychotherapist. Yeah, and so I have completely fallen in love with this therapy, this amino acid therapy. I've had, I don't know, probably 15 clients, case studies, and with just resounding results. I mean, just so cool. I have a retired rocket scientist that he just sent me his results after 2 months of being on, rocket scientist, right? He's like, this was bullshit. This isn't going to work. And he's like, this is amazing. Oh my God, you should be a doctor. Like, it's so cool. He's like, I thought it would be a bunch of crock of shit, but he's like, it's amazing. And so yeah, it's just been so cool. Like, it's all like when you can see the changes in the numbers, and they can see it too. It's just phenomenal. So I'm pretty stoked to be here, and it's good to meet all of y'all.
All right, thank you, Emily. Okay, Valsa, I know Valsa needs to leave, but let's start with Valsa. Unless she's left already. Okay, Lyle.
Okay, hi. Let's see. I came in late and I have to leave early, so I apologize. Hey, Deborah. So Lyle Freed, I live in Florida, Port St. Lucie, Florida, to be specific. I work all over. I've been in the mental health and substance abuse industry for about 20 years. I'm working currently, just got to finish my thesis and I'll have my PhD counseling with a focus on pastoral counseling and a faith-based approach. I do a lot of work with veterans and first responders. And I work for a range of companies now. I've been a clinical director and executive director and treatment center owner. And I currently work for a place that has about 7 locations with varying levels of care. 2 of them being specific trauma focused work. A lot of work with military sexual trauma, and then the typical complex traumas that veterans and first responders come across. That sufficient?
That's perfect, Lyle. So glad you're with us.
Glad to be here.
Okay, Deborah's the final one, and then if other people come on, we won't take the time until the end to introduce them, because I want to jump into the meat of our conversation today. But Deborah.
Hi, Deborah Villa here, Inside Out, helping people build health from the inside out. I'm your gut girl. I love talking about it. And I'm in Kansas City. I'm a graduate of Christina's class. I've had the pleasure of doing seminars with Christina and Lyle. And I'm just so glad that the person I was looking for to teach me that there was something to address a disease besides pharmaceuticals. So I'm very grateful to see all of you fellow learners.
Welcome, Deborah. Glad you're with us. All right. So our level 2 course has just started. It's an 8-month course, 7 months of content. And basically, to keep my head straight, I am stealing the topic of the level 2 each month for our community forum topic. And so for those of you who've not yet gotten into level 2, this is sort of a sneak peek into what you will be learning there. Today's topic is the role of proper digestion in maintaining good, solid mental health and well-being, which then, of course, supports a good, solid, serene, and radiant recovery. And there is so much about the topic of digestion that we could go into that I want to start just by asking you all, if very quickly, if there's any particular aspect that you would like me to elucidate, that you would like me to talk a little bit about. Any particular questions that you have answers to in relationship to digestion and mental health?
I think, Christina, one of the things that would be helpful in connecting it to clients, if you like, is that often the clients that we come along to bring these concepts to is how do they get from knowing little or nothing about food, being able to eat little or nothing, just about how to perhaps make some early connections, some early simple connections for people for whom food is a big, scary thing. There was a debate here yesterday in the UK Parliament. They're talking about, food and nutrition being funded by the state for poor people. And somebody who commented back on that said, yeah, but actually, that's the last thing that poor people, even if you could define what they are, it's the last thing that they're interested in. It's the last thing they know anything about. So any tips on kind of capturing people to get the wonder of food, a bit like we've got the tip that, we know what the wonder of aminos is. We've heard some, incredible things just this morning about, hey guys, thought this was a crock of shit. No, it's brilliant. It's wonderful. How can we create, those little early connections for people, the quick starters, I guess, for us getting, like Jeff said, how do we tweak that mindset for somebody in those really early stages? Sorry, bit of a long question. Hopefully you know where I'm coming from.
No, that's actually an amazing question, Mark, to the point that I think I might just make that as the topic of next month's community forum, which is our 5-star pro-recovery diet and how we even start talking to people about it.
Perfect. I'll wait till next month for the answer to that one.
Well, but I'll sort of weave that in as we go along today, because that question, it ties very much into the digestion question. Because what many of you have probably found, as I have with my clients, that when you start asking them about their diet and about their food and their relationship with food, very often the first comment my clients make is, ooh, my tummy gets upset when I eat, or I have nausea all the time, or when I eat, I get like gas and bloating. And so I just don't like to eat that much because I don't feel well afterwards. How many of you have had that experience yourself or have had clients report that? Yeah, almost everybody. And of course, if you don't ask the question, you don't find out. So this is where we differ from conventional mental health and addiction practitioners, is that we're asking the questions. We're asking about diet. We're asking about digestion. We're asking about other health issues because we're the ones that know that it actually matters. So keep up the questions of your clients. And so,
I'm just starting to work with a man who has Asperger's. And so any information on that, or I would be open to consulting about that.
Absolutely. I have a lot of experience with Asperger's, and it can be both simple and complicated. So we can definitely connect after the call anyway, but I'll try to weave that in as well. Thanks, Tom. Because people on the autism spectrum, which Asperger's is, very frequently have digestive challenges. And very frequently, those digestive challenges are due to food intolerances. Food intolerances often create many of the symptoms of people on the spectrum. So we want to know about digestion very early on in our work with the client. And to the point that my homework assignment for people in level 2 this month is to be asking all your clients about their bowel movements. We want to know what it looks like. We want to know if people are having daily bowel movements. Are they constipated? If they're constipated, how long? Because of course, if our bowel movements are one of our primary forms of elimination of toxins in the body. Toxins are eliminated through the breath, through the skin, through our urine, but also through our feces. And so if we're not regularly moving them, these toxins can actually be reabsorbed and can cause systemic inflammation, toxicity, brain fog, feeling yucky. And when we feel yucky, we're more liable to be anxious, depressed, and maybe even want to reach for a mood-altering behavior or substance. So have this somewhere in your intake or somewhere in your first couple of sessions with your clients, asking about, how do you feel when you eat? And, do you have regular bowel movements, and are they, nice and solid? For those of you who've never asked a client about their bowel movement before, it can be a little uncomfortable. And so, I recommend that you just practice it. And I introduce it with, do you mind if I ask you a rather personal question? And once they say yes, you got permission. So run with it.
Christina, can I just add something that I'm sure you're familiar with, that it might be a good resource for people if they're just getting into this poop discussion, which can be a little uncomfortable, but the Bristol stool chart, if you just Google Bristol stool chart, it will come up with a nice diagram of the different types of bowel movements, starting from, you know, very runny and watery to like little rabbit pellets, very hard. So it's a nice way for people who can kind of point to things and say, you know, that's where I'm at or something. So it's a good graphic that can be helpful with the discussion that can be a little uncomfortable sometimes.
Colleen, could you do two things for us, please? Could you both post that in the chat, but could you also pull it up? I'll screen share, and it would be great for all of us to take a peek at.
Sure, be happy to.
Okay, so I've now given you permission to screen share, so just let us know when you got it. So digestion has so many aspects to it, but the two biggest ones that I really want to address today are making sure that our clients and ourselves are producing enough digestive enzymes to break the food down into its component pieces, and that we don't have inflammation in our gut that's getting away of absorbing the nutrients. But let's just start with, first of all, why does it matter? And why it matters, as those of you who've hung around me for a while know, is that for our brain to function optimally, which it needs to do for us to feel optimal and function optimally and have a vibrant recovery, it needs to be fed optimally. And feeding our brain optimally means giving it the amino acids from the protein we eat and the vitamins and minerals required to turn those amino acids into the all-important neurotransmitters. But to do that, first of all, we need to be eating the protein and the vitamins and minerals, and that's what Mark brought up, which we'll talk about next month. But then we need to be breaking that down, and this is what digestion is, breaking down the food we eat into the component pieces so that they can get into the bloodstream, into the brain, and make our neurotransmitters. So ingestion, eating the right stuff, and digestion is absolutely directly connected to robust mental health and addiction recovery. Because if our brain's not online, if it's not being fed optimally, we're cut off on our knees, guys. You know, we're limping along. We're not running vibrantly. And so for digestion to work properly, we need digestive enzymes. Digestion actually starts in the mouth with saliva and chewing. And then it moves into the stomach and then further down. And it looks like we are here. Nice pictures.
Yes. So, and it also kind of gives you a range of what normal is. And one of the, I follow Dr. Walls. I'm a certified practitioner. If you've heard of Dr. Terry Walls, and she talks about poop a lot. And her goal is to be number 4. She said it should be like smooth, like peanut butter, and at least once a day. And actually optimal is more than once a day. So most people say, you ask them, you'll say, so are you regular? You know, and they'll say, oh yeah, I'm regular. And then you'll probe more, like how often, you know, do you go every day? They say, oh no, probably twice a week. And that might be regular for them, but you really want people to be taking the trash out every day. And as Christina said, it's one of the major ways we eliminate toxins. So it's, and the other thing that's great about this conversation is that like the toilet is like the most inexpensive gut test you can get, right? So it's free. And all you have to do is you look in the toilet and that will give you a lot of information about what's going on with your gut health.
Well, it really does. You know, getting the visual, and now I'm going to get really gross, people. The smell, okay? It's not supposed to smell horrible, okay? There will be some odor, granted, but it's actually not supposed to be, you know, so nasty that you want to puke into the toilet. Because a real nasty smell is actually a sign that there is something wrong, that there's a buildup of bacteria or yeast or some sort of inflammation or infection going on. And the same thing with the gas we produce. That, you know, we're all going to produce a little bit of gas sometimes, and that's fine. But it's actually not supposed to be tremendously smelly. If, you know, it sort of fills up the entire room and people want to make jokes about it, that is a sign that something's wrong and needs to be addressed. It could be a sign that the food is fermenting in the colon, it's not breaking down, that people are constipated. And this is the gas that is being produced by food that's just sitting there fermenting. Or it could be from the bacteria that is overgrowing and producing its own gas.
So we can't blame it on the dogs anymore.
So you can't blame it on, well, you can blame it on the dog. Actually, if the dog is passing really nasty gas, the dog's having a problem too. Okay. So, and I have to admit, I'm feeling just a little odd talking about smelly gas in a mental health and addiction recovery forum, but this is precisely why we're doing this, is because in school we weren't trained about the relationship. And it's so absolutely crucial, because the reason why, let's say, issues with your bowel movements or gas is a clue is because anytime it's a clue as to toxicity and inflammation. And toxicity, there's a direct relationship. There's been a lot of research directly connecting inflammation and systemic toxicity to depression. And also to anxiety, brain fog, fatigue, and general yuckiness. And it's really hard for people to sit in a meeting or a therapy session or even do their own prayer and individual recovery work if they're feeling yucky. Okay, if you're severely constipated, you're trying to walk into a meeting, how much focus are you going to be able to give to the speaker? Okay, not very. But what we try to do is just ignore it because we don't know what else to do. Well, you guys now know that your clients have some place and someone to go to who will take it seriously and who will have resources for them. So the very first step is digestive enzymes. Unfortunately, as we get older, we produce less enzymes, both less hydrochloric acid and less pancreatic enzymes. And so a lot of older people, and especially the elderly, if any of you have an elderly population, can have pretty severe digestive issues and will often stop eating because of that. And there will be this very rapid downward spiral. Lots of information to gain, but just know that you can buy over-the-counter digestive aids that make a huge, huge, huge difference. And that very simply, heartburn is a sign of not enough hydrochloric acid typically, rather than too much. And furthermore, just throwing this out there, acid blockers have been related to increased Alzheimer's. Do you want to speak to that, Colleen, at all, since you work with that population?
Yeah, sure. That is, what's interesting about acid blockers is that they were never intended to be used for a long period of time. And I think if you look at even the packaging, it will say it should be used for 1 to 2 weeks. And people are on acid blockers for years. I mean, some people are on it for decades. Yeah, and it's just, it upsets the pH balance in the stomach, and there's just a lot of complications from it, and it has been linked up to Alzheimer's.
Yeah.
And there are just so many natural ways to approach it, like even like using some like apple cider vinegar or HCl and enzymes. It's just so many holistic ways of approaching it before needing to go on acid blockers. And I would encourage someone to try everything possible before doing that. And if someone does need to go on omeprazole or something for a short period of time, make sure it's just a couple of weeks until things get settled out.
Right. And typically it's just used for the lining of the stomach to become uninflamed. So if you have an ulcer, if you have gastritis, then yes, we may want to lower the amount of stomach acid and certainly not add vinegar or hydrochloric acid while the tummy is healing. But we also have natural tools to help the lining of the tummy become uninflamed, such as the amino acid L-glutamine in larger amounts, 3 or 4 grams several times a day between meals, can be very helpful to reduce inflammation in the entire GI tract from the top to the bottom. So that's a substance that we're all, pretty familiar with as an amino acid. Here's another use for it. But aloe vera gel, DGL, which is a nice licorice flavored lozenge, other slimy things as well, even okra, can help soothe the lining of the stomach and can help it heal so that we can then bring in the right amount of acidity to get that food digested. Any other, questions or stories about helping people with the stomach? Because
just one kind of thing that was going through my mind that I wanted to make is that we're very focused on diet, and certainly when you improve diet, digestion can also improve, but it's important what you eat, but it's more important what you digest. So even if someone is eating the most pristine diet, if they're not feeling good, if they're not eliminating properly, if they're having digestive distress, they can be eating the best diet, but they're still not getting the benefits because they're not absorbing and assimilating those important vitamins and minerals, which they need for good health and certainly for good brain health.
Well, exactly. And so one of the things, and while I'm thinking about you here right now with your work with first responders, is one of the big things, environmental factors that can interfere with effective digestion is stress. So the more we're in our sympathetic nervous system, we need to actually be in our parasympathetic rest and digest nervous system for digestion to work optimally. So high levels of cortisol, of adrenaline, and just this really hurried, rushed eating can dramatically impair digestion. And so a lot of first responders, a lot of people with PTSD, a lot of executives who are just running, and never give themselves time to stop and relax and rest and enjoy food, are going to have digestive issues because our bodies actually secrete less enzymes when we're stressed. Mm-hmm. It's like the purpose of the body when we're, fighting the saber-toothed tiger, the job of our body isn't to digest food, okay? It's to fight the saber-toothed tiger. But if we're always fighting the saber-toothed tiger, that means that we never have a chance to shift into the parasympathetic state where our body can relax, let go, secrete the hydrochloric acid and the pancreatic enzymes and the bile that's crucial to proper digestion and absorption. And so one of the things, it's especially important to talk to our people who have very stressful jobs, very stressful lifestyles, to make this part of the therapy.
And the ones that have the 24+ hour shifts, you know, I'm thinking fire rescue in particular, that are doing these 3 days on, where every time they are about to get a little rest, the alarm bell goes off and they're on another call and they're running out the door. It's not only do you have the issue of the constant cortisol flooding, but then you don't have the proper circadian rhythm rest that you would normally have as well, which just interferes with that even more. They obviously can't take sleep aids because they're on call all the time. I'm actually working on, and certainly should collaborate with you on this, Christina, some training for them on how to combat this, because it's just a fact of their life. There's no getting around the constant alarms and the sleep disruptions, but how to best work with it and what we can do to help them through it is something I'm trying to put together as we speak, along with everything else.
Yeah, I know you, Lyle. You've got a million balls up there in the air. Well, I also suggest that you talk to Lisa Young, who's part of our community in Denver, because she also works with first responders. And she's gone through our level 2. In fact, she just graduated from it. So you guys might have some good conversations and brainstorming sessions. One of the things I would do is actually suggest that they use some gentle digestive support just routinely to support what their body is already doing. And something I'm thinking about that could be really easy for them, Lyle, is American Health has a product called papaya enzymes. And they're, I think it's super papaya enzyme or papaya enzyme plus, something like that, is where they've added pancreatic enzymes to the papaya. Well, papaya contains papain, which helps digest protein. And then when it's combined with the pancreatic enzymes, it just can help everything work better. Well, they're chewable. They taste really good, actually. And they're simple to just stick into a pack, stick into a pocket, you know, have in the, you know, just have on the table in the main rooms, so that people can kind of help themselves as needed. So I think there's some other things you could do, but this would be just a very simple, easy, good tasting addition.
Excellent. I'm going to switch to my phone because I got to get to a 12 o'clock appointment, and I'll listen to the rest of it on the drive. So I'll be muting myself, be out and back in just a minute here. Okay,
glad you joined us. Yeah, Colleen?
I just wanted to offer another suggestion, is to remind people that digestion starts in the mouth, and that chewing is a really big part of it. And we're actually asked people how many bites do they take before they swallow food, and most of us say between 4 and 8, something like that. And we want it should be over 30 is what our body can actually handle. So I know that 30 is a very high number, but just to even strive to, you know, do better than 6 or 8 bites, to really chew the food until it's liquefied. And another really good practice is to encourage people to just take several deep breaths before they start their meal, because it really does activate the parasympathetic system and just get your body into that rest and digest mode that's so important. And it's shown to make a huge difference in the assimilation of food. So whether it's just closing your eyes and taking deep breaths, or like having, if you are, you know, offering a prayer, giving thanks to your food, just that little bit of setup before you eat, and then the consciousness of chewing your food carefully can make a big difference.
Well, that's right. And when Lyle gets back on, please repeat that, Colleen. Okay, because that
First
is something.
responders.
Yes, I think it's perfect for first responders and for anybody else with a stressful lifestyle, is to just take the time. I mean, all of us anyway, throughout the day should be stopping periodically, recentering, breathing, right? Taking a moment to feel your body, to feel your feet on the ground, to come back home. So we should all be coming back home several times a day anyway. But meal times are a really good signal that, okay, this is one of the times that we really need to be coming back home and stopping and breathing and grounding. Because not only is it just good for us in general, but it's actually crucial for proper digestion.
Deepak Chopra, you got to give your stomach and everything else a heads up, something's coming. So,
well, there is that too. And so I want to encourage all of us, today to practice just stopping for a moment before we eat, even if it's a snack, and having a place for the food to land rather than just grabbing it and running. It's like grabbing it. Okay, I'm eating mindfully. I'm chewing. I'm actually chewing. And I'm chewing mindfully, because by chewing mindfully, we're actually not only allowing digestion to proceed, but we are allowing ourselves to enjoy. What a concept. Enjoy what we're eating. Enjoy the texture. Enjoy the taste. Enjoy the feel. Enjoy the anticipation. Because the stopping and allowing ourselves to notice and enjoy, that's firing our endorphins. That's firing our dopamine. Maybe the others as well, I don't know. But it is actually activating the pleasure center of our brain. And we need to be bringing pleasure in throughout the day in small ways. Because if we become pleasure starved, then we're going to start craving big pleasure hits. And that can get out of control. Okay, that's where it gets dangerous, and that's where we get into addictive behaviors. But if we're allowing ourselves to have small moments of pleasure throughout the day, small movements of enjoyment throughout the day, then our dopamine, our endorphins are continuously being alive, being enlivened. And we are going to stay more in balance, and we're going to have more of a smile on our face. And then we can have an upward spiral rather than a downward spiral. So food, enjoying it, taking the extra little few minutes it can take to create an enjoyable meal rather than stuffing something into our mouths. And I'm the first one who's guilty of that one. Can actually radiate out and have a positive ripple effect in our whole entire lives. Anybody comment on that, Mark?
Yeah, I was just thinking there. Does that to me connects to the cultures that take food very seriously, and make food a big and very deliberate part of their day. Actually, just thinking about it, some of that, the Japanese culture, for example, where food is a thing to be, eating's a thing to be enjoyed rather than just done. Yeah, I don't know. It just got me thinking that, actually, then you compare that to kind of, the America and the European, well, not even the European, certainly the UK way of eating, which actually does diverge from how Europeans eat. They eat more deliberately than we do. So, yeah.
Mm-hmm.
Interesting.
Yeah. So deliberate eating, mindful eating, dramatically impacts the effectiveness of digestion and getting those all important nutrients up to our brain. So I want to talk for a moment about the gallbladder, because many people, at least in the United States, I don't know about elsewhere, have either gallbladder issues or their gallbladder removed. I just want to remind everybody of the function of the gallbladder. It is a reservoir. It's a storage unit. So the liver actually creates bile, and bile has several functions. One of the functions is to carry toxins out of the liver in order to be eliminated in our feces. But one of the more immediate functions of bile, so bile is moved from the liver where it's created into the gallbladder where it's stored, and then it is squirted into the top of the small intestine after our food from the stomach, which is supposed to be highly acidic and all mushed up into, mush, is then sent into the small intestine. And the more acidic the chyme is, the mushed up food, when it hits the small intestine, the more likely we are to have enough bile squirted in from the gallbladder and from the pancreas to further digest the food. But it's bile's job to emulsify our fats and oils so that it can be further digested by the enzyme lipase from the pancreas. It's crucial. If that fat is not emulsified, it doesn't break down that easily by lipase, and it may just go straight through you, not get absorbed, and come out in your stool, where if the stool floats or it looks like there's grease in the toilet, that's a sign that your fat is just going straight through you and not getting absorbed. But what does that mean? Okay, why do we need to absorb our fat? Anybody?
Well, it helps make fat-soluble vitamins for one.
Fat-soluble vitamins, exactly. Vitamin, what are they? K, A, and D, and E. How about somebody else? What else?
Our brain is fat.
Our brain is fat, exactly. All of our neurons are coated in a variety of different fats. So if we're not absorbing our fats, our neurotransmitters are not getting transmitted effectively, and all sorts of bad things can happen in our brain.
Can I ask a quick question, Christina?
Yes.
Emily, you said, sorry, I missed this, but bile is created in the
liver.
Okay, but it also includes some process of the gallbladder and the pancreas.
So it's sent from the liver into the gallbladder for storage.
Oh, got it. Okay.
Okay. So think about the water that when you turn on your faucet, water comes out of your faucet. Well, that water typically does not come straight from the river or from the sky, right? It comes from a reservoir. So the water comes from the sky or it comes from the river and is held in the reservoir until it's needed in your pipes when you turn your water on. So the gallbladder is the reservoir, which means that if it's removed, there is no place to store the bile. So the liver then just continuously is dribbling it into the small intestine. Well, dribbles are typically not enough at the time of the meal or just after the meal once the food gets into the small intestine to emulsify the fat. And so this is why a lot of people have issues with fats and oils after gallbladder surgery, because typically their doctors don't talk to them about the need for bile replacement, because the bile is getting to the small intestine. It's just not getting there in the amounts needed when it's needed. And so this is where people can have a lot of tummy issues. They can have diarrhea. They can just have pain or nausea a while after they eat, because undigested fat is going to give you pain and nausea. It's just going to feel and can go right through you very quickly because the body wants to eliminate this undigested stuff. So you'll end up with diarrhea. But this
is that related to pyroluria at all, because they have troubles?
No, that's not. We'll come back around to pyroluria.
Thank you.
I mean, yes, it could be in a little bit, but that's a little more complex. So we need our gallbladder. And if we don't have one, it's very helpful to use bile salts or some product that contains bile and maybe even the enzyme lipase to digest the fat. And a lot of people find that that makes a huge difference, that they can now start eating fats and oils again, and they're absorbing it. So Jeff's client that he was mentioning gets violently ill whenever she takes fish oil. So he can't use fish oil as a supplement for her because her gallbladder was removed and it's just going straight through. Well, we all know that fish oil is an amazing tool for mental health. You know, it's an antidepressant, it can be anti-anxiety, it's anti-inflammatory, it is neuroprotective, you know, it's crucial for us. And the omega-3s are in the membrane around the neurons. So if we can't digest our fats and oils, so many bad things happen. I was recently introduced to a product by Biotics Research called Beta something. Do you remember, Jeff? Anyway, it's Beta something by Biotics Research that's specifically designed for people who've lost their gallbladder to help them effectively digest their fats and oils. And so it's possible that people who have very, very low cholesterol. So one of the reasons why I want us all to at least be glancing at our clients' medical tests, we want to know what their vitamin D levels are, among other things. But one of the things we want to know is their cholesterol level. Not because we're concerned about it being too high. That's the concern of the cardiologist. We're actually concerned about it being too low, because very low cholesterol can cause strong suicidal and homicidal ideation. The lower cholesterol is, the more likely, actually, research shows people are to have suicidal ideation and even to act on it. Well, one of the reasons that cholesterol can be very low is if we're not optimally digesting our fats. So this is another way in which optimal digestion connects to optimal mental health. Thank you, Jeff. Beta Plus by Biotics Research. Now, Deborah was talking about pyroluria, which, as many of you know, is a genetic issue that can dramatically impact mental health and behavior by depleting our body of zinc and B6. Well, zinc and B6 are part of what are required by the body to make optimal hydrochloric acid. People with pyroluria often have difficulty digesting protein. They're not making enough hydrochloric acid. Because of this, they can have morning nausea and not want to eat breakfast. But not enough stomach acid, as we've talked about, has downstream effects. So people with pyroluria can also have trouble secreting enough bile and enough pancreatic enzymes, because when the food hits the duodenum, it's not acidic enough. And so, not just addressing pyroluria with the zinc and B6, but also bringing in some hydrochloric acid help and some extra bile and pancreatic enzymes while you're supporting the whole thing can really get people eating optimally again. So, that's sort of some of the basics. We can talk about the gut, the sort of the rest of it in a minute, but any other questions or comments or stories so far? Deborah.
Question, Christina. I've heard it said that 90% of serotonin and 50% of dopamine is synthesized in the gut. So how does that translate to what gets to the brain and, this yin and yang relationship of the gut and the brain? So if you can illuminate any more on that, that'd be lovely.
So that's actually kind of a complicated question because we don't know all the answer to it. We know, and a lot of people are doing research, so we certainly know more than we used to. But what we do know is that neurotransmitters themselves, serotonin and dopamine, etc., are too large to cross the blood-brain barrier. So even though they may be made in the gut, generally our understanding is that they're staying in the gut. There may be some that get into the bloodstream, and I don't know this, okay? But what we do know is that unless there is a transport mechanism that we're not aware of, the neurotransmitters made in the gut do not get into the brain and are not reflecting what's happening in the brain. They do sort of reflect the body's ability to make proper neurotransmitters, and we're assuming that if they're being properly made in the gut, that they're also being properly made in the brain. So that can be a good reflection. But the neurotransmitters in the gut have different functions than what's in the brain.
Thank you.
Okay, it's more to run the gut.
And if the gut's involved in depression and anxiety, then that's a good thing for it to be running optimally. So
Exactly. And that's my understanding so far. But it is important that they are being made and absorbed in the gut. And this now brings us to the whole question of gut health through microbiome health. And Deborah, do you want to give us just a tiny little piece of teaching about microbiome health? Because you're so good at it.
Well, if I could share a screen, I really wanted to share one screen with you all.
Yeah, yeah.
Search. And this is, do a presentation, I always go into looking at what's new. And so this particular slide, and I'll put it in mode, is the last piece of research I did, about 6 months ago. And I put it on the screen. Can you guys all see that full screen?
Yes.
So I thanks to Patty and Christina, I'd shown that there was a correlation. And, this is the study. About 60% of alcoholics are in fact were studied for leaky gut syndrome, And it's a very small study, but after 19 days, those that had leaky gut still measured high levels of depression, anxiety, and cravings. The 34 who had normal gut flora recovered faster with lower measurements comparable to the control group. So then I went out looking at that and found out there's been a whole lot more studies. And that in 2017 there was a review done, but then now 12 original papers have been looked, and they all show this dysbiosis with cravings, depression, and anxiety when the gut is out of order. So I just thought, in case you really want to hear, or you still need to make people believe that gut has something to do with that, I think that's important. And I think that's all I'll share. Is that enough?
Deborah, can you go back just to the results of the study, the 27%, the percentages? I just want to take a screenshot of it, please.
Sure.
Thank you.
And I think that I can.
There we go. Okay, 1 second. Let me just get a screenshot.
There's the screen.
Got it. Thank you.
Yeah, I think this is a really important study. And, you know, it certainly needs to be repeated.
I thought it was interesting that the person who did this study of 12 original papers is just an employee in the government. And it's Maine. So I thought that was interesting that this person goes out and starts doing their own research and comes up with these original pieces of research.
Right. So the bacteria in our gut, and apparently there's 2 to 3 pounds of it hanging out there, we sort of have a symbiotic relationship with them. And they are absolutely necessary for our life, for our well-being, for our immune system, and for the health and functioning of our digestive tract, both for digestion and absorption. And if something throws them off, our digestion and absorption particularly will be dramatically thrown off, and there will be a lot of inflammation and increased toxicity. And this is where you're more liable to have symptoms of gas and bloating, you know, a couple of hours after the meal or all through the day, cramping, diarrhea, constipation, or, you know, strangely shaped inconsistency poop, can all be due to issues with the microbiome. There's a couple of things that are crucial to their health, and one of which is, of course, to keep whatever medications you're taking to a minimum, especially antibiotics, and only take them when needed. And keeping your junk food and sugar intake to a minimum, because sugar can feed the not useful bacteria and fungi in our gut and can make them overgrow. So we want to be keeping sugar and simple carbs to a minimum. One of the most important things, however, is to be eating fermented foods. Now, we'll be talking about this when we talk about the 5-star pro-recovery diet, but continuing to bring in the good guys. Yes, the good guys need to be fed with, ideally, according to most people, with fiber, with what's called prebiotic food. Onions, Jerusalem artichokes have a lot of these fibers that the bacteria thrive on. But by eating fermented foods, we're eating the bacteria, and somehow they do actually manage, at least some of them, to escape the stomach acid and make it into the intestine and thrive. And so I'm not a big one for fermented foods. I kind of know I should, but it's just not really been on my radar. But I do periodically, several times a week, try to eat yogurt. And I always try to make sure I have some of that really yummy raw sauerkraut in my refrigerator. I should be eating it more frequently than I do, but at least it sit there and I wave at it. Because if I can wave at it, I may be more tempted to eat it. I personally don't like a lot of sour foods. So it's harder for me to get those good bacteria in me. But it's really important to be bringing fermented foods into your diet to be keeping your microbiome happy, and a whole variety of them. And then conventional wisdom states that we're supposed to be getting both soluble and insoluble fiber into our diet to keep our intestines nice and clean, to lower inflammation, to feed the good guys. Now, the reason why I'm saying conventional wisdom is because I have a very good friend who is on the carnivore diet. She does eat a little bit of green matter, but I said, well, how are you, if you're not eating a ton of fiber, how are you feeding your microbiome? And she says, well, they seem to be just happy. And there is research showing that even in a carnivore diet, they're getting fed. So I don't know about that. I said I'd mention it because it's some people out there are really loving the carnivore diet, but I'm just going to stick with, we need fiber. We need a lot of it. We need it consistently. We need a variety of it. We need the soluble stuff. We need the insoluble stuff. Sometimes just adding a fiber supplement can move you from constipation to a normal bowel movement. One of my favorite fiber products is Daily Fiber by Country Life. Comes in capsules. It's a combination of insoluble and soluble fiber. So what do I mean by those terms? Well, insoluble fiber are things like the bran on oats or wheat or other grains, okay? It doesn't really get broken down. It's kind of used as a scraper. It helps bulk your stool. It helps clean the walls of your intestines. Some of your colon bacteria can actually use it for food, but mostly it's insoluble, which means it goes right through you, and that is useful. It doesn't go through you as diarrhea, it goes through you as being part of what can keep your gut clean. Insoluble fiber also can, as well as soluble fiber, by the way, can also bind with toxins and can help get toxins out of your system. This is extremely important when you're actually in some sort of detoxifying process. And you need the fiber to grab a hold of the toxins and remove it from the body before it gets reabsorbed. Now, soluble fiber is slimy. Okay, if you've ever ground up flax seeds and put it in water, or put chia seeds in water, or slippery elm, right? What happens? It absorbs the water and becomes slimy. Maybe that's not the best word for it, but to my mind, that's what happens. Well, so what that does is it helps soften your stool by absorbing water and make it softer. But it also contains something called mucopolysaccharides. Muco for sort of mucus to describe the sliminess. And it's actually anti-inflammatory. It's topically anti-inflammatory. So if you have inflammation in your stomach, if you have inflammation in your intestines, eating this slimy stuff will help soothe the inflammation. So this includes things like okra, which is slimy. purslane, and then things like marshmallow leaves or leaves from the mallow plant, including the common garden mallow.
Chia seeds.
And the chia seeds that I've mentioned, yeah. Slippery elm are all slimy. Licorice, this is why we have the DGL lozenges, are also topically anti-inflammatory. Aloe is slimy, mucopolysaccharides, soluble fiber.
Quick question.
Yeah.
Sorry to go back. Country Life, you said, what was the name of the supplement with the soluble and insoluble fiber?
Daily fiber.
Thank you.
Now, too many fibers supplements can actually bind to your minerals, so you don't want to overdo them. But, you know, balance here in all things, right? Okay, I'm going to stop talking.
I have a question. So in coaching clients in getting their bowel movements optimal, we definitely want their microflora balanced and good. So a good probiotic. And then is the fiber really one of the key factors in getting the bowel movements ideal in texture, shape, color?
I think it is, yes.
Okay, yeah, I figured that.
And so if they're not getting enough fiber in their food by eating the whole grains, the whole vegetables, then using a fiber supplement could be really useful.
So our goal is that they're told we're supposed to do 30 grams of fiber. So if you want to pull up a fiber chart and see how well you're doing, that'll help you relate to your clients. And there's a one indigenous tribe that I share in my talks, and they on average eat 150 grams a day, which is like 50 bowls of Cheerios. So even 30, according to, you know, and when you compare it to other cultures, is hardly anything at all. And we probably don't make 30 a day.
Yeah.
Remember, beans are our friends if you're trying to get fiber.
Yeah.
In the English, right, Mark? Make most of your toast, put beans on them. Beans on toast?
Yeah, but it's sweet beans on toast.
Yeah, it is. Yeah, yeah, with all the nice sugary tomato sauce in there. Absolutely.
I've been asking my clients to food journal, and some of them are okay with that and don't mind. But asking them to document, especially, you know, if they're having issues with their bowel movements, asking them to document the amount of fiber they're eating each day is probably really important if they can handle that.
If they can, yeah, or at least to be mindful of it. For instance, juice. Okay, this is why we prefer whole fruit to juice, because most juice has the pulp taken out of it, has the fiber taken out of it. This is why if I ever buy orange juice, and I don't very often, I'll make sure I buy it with pulp rather than without pulp. By the way, the pulp in the orange juice also contains high levels of the bioflavonoid quercetin, which is really good for you. If you use a juicer, make sure you're not removing the pulp from the juice that you make, because the pulp not only contains the fiber, but it also contains like the quercetin and other bioflavonoids and other really, really useful nutrients. And just straight juice, okay, give me a minute, Jeff, just straight juice is more likely going to be converted to sugar in your bloodstream and spike your blood sugar levels. And, you know, now we have the yo-yo thing. And juice that has the pulp still there, fiber slows down the absorption of sugar into your bloodstream, as does fat. And so we want to make, this is why we want to be doing whole fruit juice rather than strained juice. Yes, Jeff.
So I have a question following up on that about juice. So one of the habits I've had for years actually is to get, a lot of ginger, slice it up real thin, put it in like a gallon of water, bring it up to simmering it for a while, letting it sit, and then I have been throwing out the ginger because my thinking was it was too much fiber. But from what you said, I'm wondering, if I can use some of that.
Yeah,
And
chew it.
okay.
Ginger is actually fun to chew. I think it is.
You can throw
Right.
a big chunk of it into your smoothies too. It's really nice in there.
Yeah. Yeah, and
Yeah.
it does. And ginger is one of those herbs that does support digestion. There's a lot of digestive herbs, and it's a way outside the scope of this little introductory talk. But there's herbs that reduce gas, that bitter herbs help all of your secretion of all of your digestive enzymes. There's gallbladder and liver herbs that can help that process work more optimally. There's herbs that decrease inflammation. So, partnering with a good herbalist in your community, or reading, 1 or 2 books on digestive herbs, just so that you have the basics, is great fun and would be very helpful to your clients.
And I'm a big fan of kombucha. I've been brewing it for a few years now, and kombucha is pretty available even in the Costco. And it's a more, for me, I think it's easier to suggest people have kombucha than to the apple cider vinegar, but you're getting some of the same benefit, and it may be a helpful thing to replace juices and beverages. So if you haven't,
It's another really good fermented food that's not too sweet, or for that matter, too sour.
So what about all the sugar that's needed to make kombucha? Like,
it's actually consumed by the SCOBY. It's actually consumed by the SCOBY, and depending on how long you leave it on the shelf, it will go from sweet to vinegar. So obviously, I wouldn't drink my kombucha the day after I make it. I'm going to let it ferment, and then it uses the caffeine. It actually ferments on the caffeine and the sugar, and then it becomes a much more usable source of energy.
so
It's not the same as sugar.
Okay, thank you.
Can I comment on that too? So most people are looking at commercial kombucha to buy at the store, whether it's there's so many brands now, but kombucha, which once started as like a health food product, and it's kind of like how Deborah was making it with very low sugar. It's turned into like a pop drink. So a lot of the kombuchas you'll find, they're 12, 18 grams of sugar in a serving, and sometimes there's 2 servings in a bottle, so it can be really, really high. So what I recommend to people, if they're looking for kombucha, is to try to find the commercial brands that are lower than 4 grams of sugar per serving. And you really have to look for it because they're not readily available. Another option, which is lower in sugar typically, you still have to check the servings, is coconut kefir. And a lot of times you can find that. There's a brand called Kavita, and they have like a lemon cayenne and the couple of flavors that are 0 sugar or 2 grams of sugar. But both of those are great sources of probiotics, but you really do have to read the labels.
About making kombucha and not healthy is now they've got kombucha hard, and I accidentally ordered it. He didn't speak a lot of English, and I didn't speak Spanish, and I ended up getting a like 8% alcohol kombucha.
Yeah, read the labels.
Yeah, you definitely need to read the labels. Okay, anybody have stories about where improving your digestion has improved your energy or mental health?
Deborah here, and I come from the perspective of nutrition, but a lot of people do a 7-day healthy cleanse, which has herbal supplements morning and evening, and then they do nothing but vegetables and fruit. They should be eating every 2 hours and hydrating. And it's amazing how people feel better. A lot of their cravings are over in 4 days. They're sleeping better, their digestion's better. So it can happen pretty quickly, but obviously these are folks that are not detoxing or newly in recovery. I wouldn't submit. And as needed, they can add protein. But it's really amazing how, alfalfa to help the bile increase, all of that fiber and water, and they just can't believe how quickly they feel better.
Mm-hmm, mm-hmm. Well, and some of that's also because of removing the allergens.
Yes.
And we will definitely be having a community forum where we talk about allergenic foods and food
Great baseline
sensitivities.
for people to start doing an elimination diet and only introducing 1 or 2 things at the resumption of adding protein and other things.
Absolutely. So when I'm working with all of my clients, I always, 90% of the time start with digestion. There are a few times that I don't, especially if it looks like everything's okay, but a lot of the times I will really focus in on digestion and ingestion before I jump into any use of supplements, because sometimes just that by itself is going to make a tremendous difference to people's mental health. All right, any other questions or comments before we call it a day? All right.
Thank you.
Christina, can I just jump in and just remind people we've got the networking, the Academy's networking group on Thursday the 15th coming up. And
Great. What time of day is that, Mark?
So that's set at 12 noon Eastern.
Okay.
And then following on the Saturday 17th and Monday 17th, practice growth and collaboration groups as well. Again,
Perfect.
On that.
And the purpose of the networking sort of lunch and learn, as it were, is just simply to get to know each other, to share our skills and expertises with each other, so that we know to whom to refer our clients when we've come across something outside of our scope of practice. Because we have a brilliant community. And we really want to be referring to each other and supporting each other. And the best way to do that is to get to know each other. So the purpose of the networking groups is just simply to say, hi, this is what I'm good at. What are you good at? And how can I refer to you if needed?
Yeah, absolutely. And I would add to that, it's not just about necessarily the kind of referring out. I think what I'm beginning to see here is some collaborations of people working together with the same client as well.
That too.
Even on combined programs, that potentially where there's an element that we're not feeling particularly strong on, and actually getting someone else to kind of do that bit of work and packaging the thing up as a program. So yes, there were some exciting discussions the last one. So yeah, there we go. And so practice growth and collaboration on the Saturday 17th, Monday 19th.
So will you send a slide or something about the details on how to?
Yeah, we'll bob an email out. So there'll be an email come out for both of those to remind everybody.
Is that at noon too, Eastern?
Yeah. Yes. Yeah, indeed.
So, should I have been getting emails already, Mark? Or
you should have. Have you not been getting them?
I haven't either.
I haven't. I don't think I have. Christina,
okay. I'll take care of that. I'll make sure you're both getting them, Emily and Laura.
Thank you.
Yeah,
I'll put my email in the chat.
Yeah. My apologies for that. I don't understand.
I haven't gotten either.
You haven't either, Deborah. Okay, so that may be potentially. I think there's been a little issue. Perhaps a couple of people I think have unsubscribed from the main mailing list potentially. So that may well have been why people haven't been getting them. But I could just add you back in specifically. I'm not saying that's what you've done, but theoretically you should all have been getting them. But I'll make sure that we.
Could have gone to my junk
I'll
mail.
make sure you get them.
It could have gone to my junk mail, and I usually don't have time to dig through it all. So
Yeah, no, for sure. I mean, if you're particularly interested, are you on?
He's a current student. Both Laura and Emily are current students, so they should be, getting it that way. But anyway, we will
But I'll
be
check.
addressing that. Yeah.
Absolutely. Thank you.
All right. Bye, everybody. Thank you so much.
Bye.
Thank you.